Hi,
Hey there.
how are you?
Okay, how about yourself?
Doing pretty good. How's quarantine been for you?
For us, it's not that big a deal. We have a beautiful piece of property. We lay out on the deck. We play ping pong. We take walks on the road. It's actually quite nice. In fact, we're planning on going to Cape May, New Jersey for a beach vacation next month.
Ooh, fun.
Yeah.
All right. So I have some questions that I would like to ask you.
All right, don't make them too hard though, okay?
Yeah. All right. So the first question is, I know a lot of Lyme patients are very worried about contracting COVID-19 with their weakened immune system. And could you tell me what you're doing to protect your patients, like myself?
Sure. So, regarding the weakened immune systems, fortunately for us, I think we've only treated maybe 12, 13, 14 COVID patients at this point. We have not treated massive numbers. Now, it's possible some people have been infected and we don't know, but so far people have actually done quite well. The main thing that people need to look for with Lyme is if they don't know their immune system status, like if they have low immunoglobulins, you can get low immunoglobulin G, you can get subclass deficiencies. Some of the Lyme patients have had anaplasma, which would affect how their immune system functions. They may have problems with mold toxins like gliotoxins that are immunosuppressive. Some of them, their natural killer cells are low. So, I think there are some basic things that you can check, but essentially what we've been using to protect our patients is kind of a three-step protocol. The most important of the supplements we're using is NAC, N-acetylcysteine. The next one is alpha-lipoic acid, and the third is glutathione. And we published an article in the Journal of Respiratory Medicine case reports about, I think it was almost 3 weeks ago by now, where we had 2 case studies on patients with COVID pneumonia who had shortness of breath, and within an hour of taking glutathione, they got better. So we looked into the reason why people would get better from glutathione, and what was really fascinating about when I kind of dove into the medical literature is that they've shown there's low glutathione levels in the blood with people with bacterial and viral pneumonia, low glutathione inside the cells, in the lung tissue, and the same thing in ARDS, acute respiratory distress syndrome. So that's one of the worst complications of COVID. And it's in the medical literature that low glutathione levels are found in the lung tissue in these kind of conditions. So it made sense when I looked at the cytokines, these inflammatory molecules being secreted from COVID, it turned out they were the same ones that were being secreted in Lyme. And since we have 30 years experience shutting down these cytokines, the cytokine storm they're describing with COVID is kind of like having a horrific Herxheimer reaction for a Lyme patient, but the inflammatory molecules are the same. So it does look like glutathione is helping people. So what I'm recommending is most people take a minimum of 600 milligrams of NAC and acetylcysteine twice a day, even 3 a day. 1,800 milligrams is even better. Alpha-lipoic acid, we're using 600 milligrams twice a day. People with hypoglycemia just have to be careful that their blood sugars don't go low and swing with it. That's pretty much the only side effect I've ever seen, and it's very rare. And glutathione, if you're young and you're healthy, you can probably take 250 milligrams twice a day of glutathione. But for someone who's older, like I'm over 60 and I'm taking 500 of glutathione twice a day, a gram, right, a day. And if you get COVID pneumonia, then we're upping it to 2,000 milligrams of glutathione all at once, and that can be repeated 2 or 3 times a day. So I would say that probably the 3 most important supplements we're using to protect people is NAC, alpha-lipoic acid, and glutathione. And what these are doing is they're blocking a switch inside the nucleus called NF-kappa B that is turning on all of these inflammatory molecules. The second way we're protecting people against the inflammatory response is using turmeric, curcumin, and also using broccoli seed extract. And these 2 things are what are called NRF2 activators. They lower inflammation through a whole separate pathway. And the third thing is using vitamin C, a gram 3 times a day, zinc 40 to 50 milligrams per day, and then using things that raise natural killer cells, which are the cells that your body uses to fight infections. And we're recommending 3,6-beta-glucan. It's a derivative of a yeast, and it can up your natural killer cells by 250 to 300%. So, these are 8 different supplements. People don't have to take all of them. I would say out of them, probably NAC, alpha-lipoic acid, and glutathione are the most important, probably followed by zinc. And And I think if people would do that, you know, we're trying to open up the economy and get people back to work, but they're not really letting people know how they're going to protect them from getting sick. And all the literature, at least the basic science, suggests that having enough glutathione, the interesting thing is glutathione also has antiviral properties. So viruses, the way they turn on in the cells is they need oxidative stress, and there's published articles on glutathione and NAC that they have antiviral properties. So, you know, we've been looking to do a placebo-controlled, randomized controlled trial eventually for this. I've been speaking to researchers, and I'm hoping somebody will eventually take an interest in this. The first place we would look would be the nursing homes. And because the nursing homes, of course, the elderly patients have been dying off in droves, and that would probably be the first logical place, is give one nursing home NAC alpha-lipoic acid glutathione, don't do it in another nursing home, and then watch the morbidity and mortality. So that's the study that we would like to design, and we'll kind of see where it goes from there.
Wow, that sounds amazing. So back to like the similarities and differences in COVID-19 and other tick-borne diseases. Have you like noticed anything else with like similarities and differences, I guess? Are there any like shocking similarities that you found other than what you've previously mentioned?
No, I mean, you know, when you look at Lyme, I mean, it's interesting because, for example, with Lyme disease, you're always looking for dermatological manifestations like erythema migrans rash. So what do we have in COVID? We have COVID toes, right? We have people that are having these like bluish areas that kind of looks like pernio, like they got frostbite. And that's showing up in some young people. Unfortunately, it doesn't look like the outcomes are terrible. So we're looking for dermatological manifestations in both. The inflammatory molecules that are secreted are pretty much exactly the same, right? So from that perspective, we're getting a very similar inflammatory reaction. The testing for Lyme is unreliable. The testing for COVID is unreliable. The antibody tests miss anywhere between 20 to 33%. Right? There's IgA, IgM, IgG antibodies. The PCR testing, the nasopharyngeal swabs are probably a better way to go. And they just released an in-home saliva test. Just this weekend, they released a in-home test. I'm not sure when it will be available. I believe this one is from Rutgers University. And then there's another test, which is an antigen test. And that test will be able to be done in doctor's offices also within 15 minutes. So instead of an antibody, it's an antigen to prove active infection. So those tests were just approved by the FDA. Hopefully that will kind of speed up the testing process for people. But Lyme and COVID, we have, you know, unreliable testing. And then in Lyme, we know that it's a chronic persistent infection. And in COVID, they found in the Chinese study that 13 or 14% of the patients who tested positive by antibody, who were asymptomatic, they got over all of their symptoms, they went back to work, and they were following them every 2 weeks, 13 or 14% reactivated the virus. The virus came back. So just like Lyme can reactivate, right, from dormant, you know, biofilms, right? We've got these persister cells that are dormant in biofilms, and all of a sudden, certain things will wake them up. It does look in some people like the antibodies are not going to be completely protective, and that the virus can return. So in some ways, Lyme and COVID actually do share quite a few things in common. But I think the most important really is that it's the inflammation, the inflammatory reaction in Lyme that makes people sick. It gives them the good and bad days, the symptoms when they come and go, the joint pain, the muscle pain, the nerve pain that moves around their body with the tingling, numbness, burning, the memory problems, the cognitive issues, can't fall asleep, keep waking up, mood changes. They're all due to inflammatory cytokines, these inflammatory molecules. And the worst complications of COVID is from these cytokine storms and these people that get what's called macrophage activation syndrome, which is a very severe form of too many cytokines released. And really, so what it looks like to me, looking at the literature, is we just have to shut down the inflammation. And I do believe in my heart of hearts that NAC, alpha-lipoic acid, and glutathione, it's safe, it probably will be effective, it's inexpensive. We have no other means of protecting the American public at this point. And I believe that this treatment will probably work. And the fact that it even has antiviral properties, I was just reading the literature this morning about it. I think it's almost too easy to be true, but it's kind of like what I've done for Lyme in the last 30 years can translate over to COVID. And that's really quite exciting. And since we published this article, my co-author, James Persasi, has said that a lot of his medical student friends and people have contacted him and said, you know, I also got COVID. I had the pneumonia. I took the glutathione, and within an hour, I was better. And we recently had a patient who hadn't spoken to me in 7 years, and she contacted us and said the same thing, that I was doing well with Lyme. I got COVID. I saw your article. I took 2,000 milligrams of glutathione, and exactly as you described, within 1 hour, my shortness of breath was better. So when you consider that it's not the virus making people sick, it's the hyperinflammatory syndrome that's making people sick. And we've learned over 30 years of treating Lyme how to shut down the inflammation. You know, we block NF-kappa B with NAC, alpha lipoic acid glutathione. We stimulate NRF2 with curcumin, broccoli seed extract, a sulforaphane glucosinolate, green tea extract, resveratrol. We use zinc to raise the immune functioning and to protect against inflammation. Even the NIH has a double-blind controlled study on zinc in the elderly, where it showed that these people did better. And in our Lyme population, we published the study 2 years ago with Phyllis Freeman and myself that 18% of our patients were zinc deficient. So, you know, you don't want to be zinc deficient and be exposed to this virus. So I do think there are things that people can do. We obviously need randomized controlled studies, but I feel confident, having used this kind of treatment for decades, it's way safer than pharmaceuticals. These are nutraceuticals, and I think that's why there's not that much interest, is because no one's going to make a boatload of money off of this. It's very easy. It's available for everyone. And that's kind of the message I'm putting out right now is please look at this, because I think it's a way of protecting yourself and your family while we're looking at getting certainly better research on it with these controlled randomized studies.
That is incredible. So with your new articles that are out, oh, can you hear me? You're on mute. Can you hear me?
Let me see.
I can hear you.
There we go. Okay, I got it.
Okay,
By the
so
way, this happens with Zoom. I have not figured this out, but every once in a while, when I have microphone plugs in, all of a sudden it goes mute, and then I have to reset it. Have you ever had this problem?
I have had it a few times. I mean, I use this for class, so it's been pretty interesting, new, I
Yes.
guess. So with your new articles out, where can people find these articles so they can read it and possibly get these new medications that you think could be very beneficial?
So the article was published in the Journal of Respiratory Medicine Case Reports. It was published in April of 2020. So if they do a Google search and they just do Horowitz, Richard, Journal of Respiratory Medicine Case Reports, and then just do a search and put glutathione, COVID-19, you should find the article. And we just had a front page in the New York Post this past weekend on it. We got a lot of press with it because it was Mother's Day, and James Persasi, my co-author, of course, helped his mom. He had called me up and asked and said, my mom's got COVID. She's not responding, to Plaquenil and Zithromax, and even Olivia, what should I do? And we tried the glutathione and she got better. So the Post picked it up, and so we've gotten a lot of good coverage with it. So people should be able to find the article online. And I also have another one that I'm looking to get into peer review as far as hypotheses that I think need to be examined at this point. But the type of things that I'm discussing, these nutraceuticals, they're not pharmaceuticals, they're nutraceuticals, NAC, alpha lipoic acid, and glutathione, it's available on the internet, right? You just have to make sure with the companies, whatever company you're going to use, that it's GMP, good manufacturing processes. You want to check the company to make sure that there's no mold, there's no heavy metals, that what they say is in the capsules will actually be in them. Now, there's a way of getting in cysteine, which is one of the precursors of glutathione, from people who can drink whey-based protein drinks, whey, W-H-E-Y. That's a form of cysteine. Cysteine is an amino acid. So, there are ways of getting in some of these things naturally, and your body makes glutathione. But the problem is when you're where you have a lot of environmental toxins, when you're exposed to heavy metals, when you're exposed to pesticides like glyphosate, that uses up the glutathione in your body. So if you're using up your glutathione, which is the main primary antioxidant that's protecting your cells against oxidative stress, and then you're exposed to the virus, you don't have enough antioxidants, especially glutathione, to protect the lungs, to protect the kidneys, to protect the liver, to protect the brain. And, you know, when I looked at again, all these articles coming out, Kawasaki disease in the young people, at first they thought the young people weren't getting sick, and then they thought, in fact, well, some people do from inflammation in the blood vessels. But again, it's due to inflammation. There were some adults that got acute necrotizing encephalitis, a very bad complication of COVID, with some people getting clots, either pulmonary emboli or having strokes, right, in young men. So again, it's from inflammation in the blood vessels. So all of this is due to inflammation. And what's interesting is for the viral machinery, for the virus to turn over and replicate, it must have oxidative stress inside the cells. And glutathione will help prevent that from happening. And that's why we need a randomized controlled study as quickly as possible. But these supplements are available online and they're not very expensive. So, you know, this is kind of my approach. If I was at HHS and, you know, giving advice to the whole country, I would of course say, look, we don't have randomized controlled trials, but I have 30 years of using these supplements safely. You just have to watch for glutathione for people that have chemical sensitivity. If they're sensitive to sulfa molecules, they should be careful with glutathione. But usually it's not the case with oral, it's more IV glutathione that they have to watch for. But, you know, we need a study of glutathione in the intensive care units. These people who have acute respiratory distress syndrome, that now they're finally starting to look at using heparin because the low oxygenation they finally figured out was in part due to pulmonary emboli. These are the same group of people whose lung tissue has been affected. We should be doing a randomized trial of glutathione IV to see if it helps these very severe people on respirators, since the death on respirators, of course, was very high. In the New England Journal article and some of the Chinese articles, it was like up to 88%. I think now it's coming down, and the cases in New York, thank God, are finally coming down. But we need to find ways to be able to treat these very severe people in the intensive care units. You know, I hope maybe a pulmonary doctor or an intensivist will be listening to this talk and maybe give them some ideas and have them contact me.
Yeah, I mean, that would be amazing if they were listening to this. I would hope that all of them were listening to this, actually. Okay, so switching gears a little bit. So one of the papers that you recently published on, it was about fetal transmission of Lyme disease from mother to child. Could you, elaborate a bit more and tell me about what you found?
So, you know, there's been a controversy in the medical literature for a long time. When I have women come to me all the time, they want to get pregnant, they want to have children, and they say, is it a danger, right? Will I pass it on to my child? And the literature has been kind of a little bit all over the place. There have been articles that say yes, there have been articles that say no. So, you know, I thought it would be a good idea. I had one patient in particular, really fascinating case. She initially came from Europe. We talked earlier that one of the dermatological manifestations of Lyme is this erythema migrans rash. Well, that's from Borrelia burgdorferi sensu stricto. It's one of the forms of Borrelia. In Europe, they have another type of Borrelia. It's like a cousin of the Lyme disease bacteria we have here called Borrelia avzelli. And it causes a rash on the hands and the feet called acrodermatitis chronicum atropicans. It's a violaceous skin rash. It's pathognomonic basically for Lyme disease in Europe. So this woman happened to have had both an erythema migrans rash, Borrelia burgdorferi. She had an ACA rash, meaning she had a chronic infection with Borrelia avzelli, and it's been shown in the literature that it can persist in the skin. And she got exposed to Babesia. She got exposed to, you know, other co-infections. She was sick, and she came from Europe and went to California for a couple of years, wasn't getting better, came to see me in New York. And she said to me shortly after seeing me, I'd like to get pregnant. And I told her about this patient of mine. It was about 20 years before. I treated her for, I forget if it was a year. She got over the Lyme. I asked her, you know, do you have any symptoms? She said, no, maybe 3 weeks ago, I had a little bit of migratory pain, like brief, like short, but literally, doc, I have nothing. I'm completely fine. I said, fine, go get pregnant. And she got pregnant and she lost the pregnancy at about 14 weeks. And we did a PCR, we did a DNA analysis on the fetus, and the fetus was PCR positive for Lyme, for Borrelia burgdorferi. And I think at that time, so was the placenta. She tried to get pregnant again. Again, she lost the baby 12, 14, 16 weeks. Same exact thing, PCR positive. So we put her on an oral antibiotic. I forget at the time if it was Ceftin or Omnicef. And again, she lost the baby, so we had to put her on actually IV Rocephin, IV ceftriaxone for the first trimester, and she carried the baby to term. But I learned from that one patient that it is definitely transmissible in women. And ever since then, in the last 20 years or so, I've probably had at least 100 women who we've put on a antibiotic, a cephalosporin like Ceftin, cefuroxymaxatil, 500 milligrams twice a day during the 9 months of pregnancy. And all the babies have been fine. All the babies have been healthy. Now, we've occasionally had in the cord blood or in the placental fluid, we've occasionally found PCRs for Lyme, for mycoplasma. These things have shown up. We even had a Bartonella fish come back on a woman recently who had Bartonella, who had chronic Bartonellosis. So it's not that it can't somehow show up in the fluid, but the babies have been healthy. And because this woman had 4 consecutive pregnancies, one right after the other, and she opted for using bicillin, benzathine penicillin, which is a long-acting form of penicillin intramuscularly. We did this with Zithromax, but she relapsed with her babesia during the 3rd trimester of her pregnancy in 2 out of the 4 pregnancies. And I thought, the babies can basically have very severe complications if the mother's not aware that they have babesia, this malaria-like illness. The babies can have hemolytic anemia, require blood transfusions, be very, very ill, and could die. So we gave her atovaquone, Mepron, with Zithromax in one of the pregnancies, also with clindamycin, and the babies were healthy. All 4 babies were healthy. There was no signs of transmission of babesia because babesia, just like Lyme, can be transmitted from the mother to the fetus. And we thought, this was an unusual case. She had evidence of these 2 rashes. She had 4 consecutive pregnancies showing the safety of this intramuscular form of penicillin. There's very few articles that were written about treating babesia in pregnancy. The only prior articles, like by Dr. Krauss from the New England Journal of Medicine years ago, was using clindamycin and quinine. And for anyone who's ever taken quinine, it's a very difficult drug to tolerate. You get ringing in the ears, you get nausea, you can have vomiting, rashes. It can cause problems with the electrocardiogram, with QT prolongation. So it's not an easy drug regimen. That's really the only one. So we published on Mepron and Zithromax with or without clindamycin, which are all drugs that are safe, certainly at least in the 3rd trimester. And we thought it was important to kind of get it out there for women to say, you need to protect yourself. The Lyme, it can be transmitted from mother to fetus. You have to be careful with co-infections. But here's, for example, one regimen that might be helpful. And I've been watching the controversies in the medical literature for years, so I thought it was a great case and it was just a great opportunity, right, to be able to share this information.
All right, thank you so much. All right, another question. So in the Lyme world, a lot of people are really excited about the drug disulfiram, and I know that you didn't put me on the drug because of the side effects. Instead, I did the Dapsone protocol. Could you talk about the pros and cons of this drug and which one you think is better, about disulfiram or Dapsone?
So both of these drugs are for the persister forms of Borrelia. And I think they both have indications. The problem is when the first article came out by Dr. Liegner the year before on it, it was just 3 cases. I had used disulfiram antabuse years ago for alcoholics. I did my medical training in Belgium, and it's very rainy, very dark, very cold. People drink a lot. It's a European habit, but they drink a lot. So I saw a lot of cirrhosis of the liver when I was in Belgium. And I had experience using the drug. And truthfully, I found the drug to be well tolerated, at least when I gave it out years ago. So I didn't expect, honestly, there would be many problems from using it because I had experience with it. And we started using the drug, and one of the first things we saw is that the drug has a potential to cause just massive Herxheimer reactions, like pretty much some of the biggest Herxheimer reactions I've ever seen. So one of the things we learned over time with the drug is that you've got to go very low and go very slow. And at this point in time, the optimum dose that I believe most people will get to disulfiram is not going to be 250 milligrams twice a day. I think the side effect profile of it is basically not worth it at the full dose. I think for most people, they will find that 125 milligrams a day, taking 3 to 4 months to work up to that dose. Some people will work up to 250 milligrams a day, again, taking 3 to 4 months or even 5, 6 months to work up to that dose, very slow. We found that if you go very slowly, that some people will get better with the drug, but the problem is it's a very unpredictable drug. You can be well, and then all of a sudden, 3 days later, have a massive Herxheimer reaction. And part of the concern with the drug is that years ago, when they were giving it out to alcoholics, there were some cases of neuropathy. Now, the problem initially with evaluating the drug is we know that alcoholics can get neuropathy because they have B vitamin deficiencies. For example, they have B1 thiamine deficiencies. It causes something called Wernicke's encephalopathy. We know that these people are at risk for B vitamins. So it's very difficult to say, because also some of these alcoholics could have been exposed to Lyme, and they took disulfiram and had a neuropathy because it was actually kicking up the Lyme or kicking up Bartonella, right? So there are a lot of theories as to why the drug could have actually caused it. Now that we have experience with about 150 people, we probably had about 5 or 6 people out of 150 who have had some form of neuropathy. Fortunately, many of them who got it, it's starting to reverse. Not all, but most of them it is. We're giving high-dose B12 and B1, B2, benfotiamine, alpha-lipoic acid. We're doing things to regenerate the nerves, mitochondrial function, but there's a risk. Now, the problem with the drug is the only reason that I'm still using it is because there's no doubt that in a subset of people, they said it was one of the best drugs they ever used for Lyme. But the problem is that if they had Babesia, it didn't work long-term. They relapsed. Their Babesia fishes were positive. If they had Bartonella, disulfiram didn't work. The Bartonella fishes were positive. So the place where I think, and it's not that it doesn't have some effect against Babesia, it does. It has antimalarial effects just like dapsone does, but it's not enough to completely eradicate the parasite from the body, and it's definitely not enough to eradicate Bartonella. So where I think the drug has usefulness is some people that can't tolerate a lot of antibiotics because the microbiome of their gut just can't tolerate it. They have to not be sulfa sensitive. It's a bit more sulfa sensitive than dapsone. They're both sulfa drugs, but dapsone is less sulfa sensitive than disulfiram. But it's a tricky drug to use. And actually, truthfully, dapsone's a lot easier. So where I use dapsone, I sometimes use them together. I've had patients who've been on disulfiram and dapsone together with doxy and rifampin. And some of these chronically ill Lyme patients said, absolutely adding disulfiram to that regimen got into parts of their body that no other regimen got into. So I think there is a utility to the drug, but I do not think it's going to end up being curative. It's not going to be the magic bullet that everybody was hoping for. And you have to pay a lot of attention to diet. You've got to be on a sugar-free, candida-free diet, because if you're having sugar and you get a candida syndrome where you're making molecules of yeast that can form alcohols in the body, you can get sick from it. You have to be careful. There's a lot of dietary things and even supplements and shampoos and skin lotions. People just have to be really, really careful on disulfiram or they get nauseous and they don't feel well. So where I would use the 2 drugs at this point is if someone never had evidence of Babesia or Bartonella, there's not even a doubt in my mind that the double-dose dapsone protocol that is 8 weeks, maybe 12 for some people, is preferable, because it takes at least 5 to 6 months to work up the dose of disulfiram, massive herxes. I can get someone better. In fact, I just spoke to someone recently again who did the double dose dapsone. And in fact, I spoke to him a few days ago. He's been sick for probably a decade. And he's now at about 92%, 93%. He's about 3 months off the protocol. Every few weeks, he's better and better since stopping it. And he said it was the best he's ever felt in all the years of treating Lyme, and it was only 2 months.
Wow,
it was an 8-week oral protocol. And when you did it years ago, by the way, you did not do the double dose dapsone. You were the youngest person I ever treated with dapsone, right? Yeah, so I was, and truthfully, I was quite fearful actually giving this to you, but I knew how good the drug was because of how my wife responded. And I felt like it was my medical obligation to use the best that I had. But I do think that if it was just Lyme without co-infections, an 8 or a 12-week dapsone protocol, it's closest I have seen to a cure. However, the problem is going to be if people have Babesia or Bartonella. If they have co-infections, dapsone will not work. Same problem with disulfiram. So that's how I kind of figure out when I want to use dapsone alone and not even look at disulfiram. Mainly it's if people don't have co-infections. Unfortunately, most of the people who come to me do have co-infections. 80% or more have Babesia. The more we are able to do Bartonella Western blots or Bartonella fish testing from IGeneX, the more we're seeing Bartonella be a problem. So, I think all in all, I do think that these drugs have great potential. I still think we need, more research on figuring out how best to use them. And for me, truthfully, if we could figure out better drugs for treating babesia, right? We don't have a cure for babesia at this point. The drug tafenoquine, it's kind of like Lariam, a floquine that came out years ago. It may have some potential, but not enough people have used it to really know. Bartonella is probably the most difficult co-infection I'm dealing with. When I have cured Bartonella, unfortunately, it was in several people that took gentamicin intramuscularly or IV. And it's a very tricky drug because it can affect hearing and it can affect balance. So, but for example, I had a woman in Arizona, she was sick for 13 years with Lyme and BART. She could not come off antibiotics for more than a week before she would crash. And after doing a 5-drug regimen with gentamicin, she's now 2.5 years symptom-free with not one symptom. So gentamicin was published by Johns Hopkins University from Yingzhang the year before, but the drug is just very tricky to work with. Tobramycin may have a little bit less side effects on the dizziness component, but has a little bit more with the hearing. I tried methylene blue from that Hopkins article. It might have been helpful, but it wasn't curative. I tried berberine. I tried clotrimazole. I tried macrobid. These are all the drugs that Yingzhang had talked about. None of them were sufficient. So I was using drugs against Bartonella for actively growing forms like doxy, rifampin, zithromax. I was using macrobid or methylene blue or others for the persister forms of BART. Still wasn't enough. Not that people might not have improved, but I'm looking for cures. So I think where the research really needs to go at this point is we just need a lot more research, especially on Babesia Bartonella, because if people don't have these co-infections, the double-dose dapsone protocol seems to actually work for the vast majority of people I've tried it on.
Wow, that is incredible. Is there anything else that you would like to talk about?
No, I mean, the only other thing I'll tell people about this during this time is, of course, May is Lyme Awareness Month. For those of you who are not used to putting picaridin spray all over your arms and legs and face and neck, or IR 3535, using a tick repellent right on your skin, taking your clothes outside and spraying it with permethrin, right, which will kill the ticks, and it's good for a couple of weeks. Coming indoors, doing tick checks. This is very important because now that COVID is around causing an inflammatory reaction, you don't want to get a tick bite at this time of the year. That's double trouble, triple trouble when Babesia and BART are on board. It's like you really don't want to go there because then it's just inflammation on top of inflammation. So I think prevention is the most important other message I could give to people these days, and to give them hope, because the double-dose dapsone protocol, my wife is at least 2.5 years symptom-free at this point. We have had patients that have done very well with it. Eventually a randomized controlled trial needs to be done with it also, of course, but everyone's focus right now is on COVID. But even the hope for COVID, I can't speak beyond what I know, but 30 years of treating Lyme-Herxheimer reactions with these inflammatory cytokines and seeing the safety of the nutraceuticals that I've described today with NAC, alpha-lipoic acid, glutathione, with or without curcumin, broccoli seed extract, sulforaphane glucosinolate, zinc, vitamin C, 3,6-beta-glucan. You don't have to do them all, but I've had years and years of experience, and they are safe. They seem to be effective. Just about everybody we've given it to with COVID has had a response. We have nothing better at this point to protect people as they go out in the world. So, I think personally, until somebody comes up with something better, if you said to me, Doc, what are you doing? What is your wife doing? How are you protecting yourself? Because you're going to go on vacation next month, right? We're on NAC, alpha-lipoic acid, and glutathione. And, when people have gotten the virus, I've had some luck with ivermectin. It's an anti-parasitic drug. There's 2 studies published on COVID, one in culture in vitro, and the test tube showing it was effective against COVID, and in a multi-center trial that was done in Asia, China, Europe, and the United States, they found that people on ventilators, when they were given a high dose of ivermectin once, the mortality rate went down, and it lowered the viral load of COVID by 5,000-fold within 48 to 72 hours of one dose of ivermectin. So, they're looking at remdesivir, which cuts, 4 days off your hospital stay. And they're looking at lopinavir and ritonavir and ribavirin and all these things in combination. They're expensive, right? They're IV. What I'm describing is easy and simple. And if our healthcare system wasn't so focused on pharmaceuticals and making money from the pharmaceuticals and open up their eyes that these nutraceuticals and natural methods are available and maybe a way of saving lives and helping our country to get back on its feet. I don't know, folks. You could get this study done in a week. You could be doing this in an intensive care unit in 1 week and you would know the answer. You could be doing it in the population, in a nursing home. You could do it within several months. You would know the answers. So I just hope that eventually a researcher is going to take me up on this, because I feel like I may have a potential solution, and the frustration of knowing that I'm sitting on something that could benefit so many people, and I can't get anybody to bite and say, we're going for it. And I did meet with researchers last week. The Department of Defense did get back to me. I emailed all my contacts at the CDC, the NIH, the FDA, the Department of Defense from the Tick-Borne Working Group, and I said, hey, I published this article. Is anyone interested in doing a randomized controlled trial? The only person that got back to me was from the Department of Defense, sent me to the website and said, we have monies available. I told the researchers from Arizona, California that I spoke to last week, please check this out. And I'm speaking to everyone I can think of as far as please, let's get a randomized trial of this. It's so simple, it's easy, it's safe, especially compared to everything else that they're talking about right now. Going back to work to get the economy going by wearing masks and social distancing, that's really not protecting you. That's not really what we should be doing at this point. Not that it's bad, but it's not enough protection. If you were a father or your mother and you were sending someone out onto the front lines, you want the greatest protection you have. And although we don't have the randomized controlled trial, we have the basic science. The basic science says viral bacterial pneumonia, acute respiratory distress, glutathione levels are low in the lungs, they're low in the blood, they're low in the tissue, and glutathione has antiviral properties. If the virus can't turn on the machinery through oxidative stress, you don't get sick the same way. This is published in the peer-reviewed literature way before we ever got to COVID. So we have to also look at the basic science and stop looking at just pharmaceuticals. So that's my message for people at this point, is please everybody open up their eyes and their ears. There may be solutions in front of us, but until you actually try it and you take me up on this challenge, and I'm throwing down the gauntlet, right, for anybody that wants to take me up on this, odds are it's going to work. Right? So I think we just need the studies done at this point, and hopefully somebody high up is listening to this and will do something about it.
Yeah, definitely. I hope that whoever is going to watch this in the future hopefully has some good contacts that could help you.
Yes.
Well, thank you so much for having the time to join me on this Zoom call, even though we may not know how well Zoom works. I'm still trying to figure out how it works, but thank you so much.
My pleasure. And stay safe, and please send my love and blessings to your family.
Thank you. And I hope to see you and Lee soon.
Yes, thank you. And for everybody out there, for the Lyme patients, sending you love and blessings, and stay safe. And please read the article that we published online and dive into the science. The science is there. There are things that we might be able to do to protect you that is just not being talked about, that is out there. So blessings to everyone.
All right. Thank you so much.
Great.
Bye.
Okay. Keep in touch. Let me know how things go.
All right. Bye.
Okay. Take care.